Hello everyone, today we are going to study about membranous conjunctivitis. So let's start. Membranous conjunctivitis. Membranous conjunctivitis is an inflammation of conjunctiva in which a membrane or pseudomembrane forms over the conjunctival surface due to infection or inflammation. It is just a new membrane covering the conjunctiva. Okay, and the type of membranous conjunctivitis is first true membranous conjunctivitis and pseudomembranous conjunctivitis. Okay, true membrane conjunctivitis, as we know that true membrane conjunctivitis is a severe inflammation of conjunctiva, okay, and in which the membrane is firmly attached with the underlying tissue. So what we have to learn or a key point of this true membrane conjunctivitis is that because it is a severe inflammation of the conjunctiva and it is firmly attached with the tissue of the conjunctiva, that's why during its removal it's caused bleeding. And in another, which is a pseudomembranous conjunctivitis, uh, during its removal there is no any bleeding. Okay, so let's cause. Main cause by diphtheria. Okay, its main cause is diphtheria and it is a severe bacterial infection. The clinical feature of true membranous conjunctivitis is severe redness, pain and watering, swollen eyelid, thick grey-white membranous of the conjunctiva, bleeding occurring in removal of membrane, fever and weakness, enlarged auricular lymph node. Okay, then next uh, then next is management and treatment of true membranous conjunctivitis. Then first is isolation of patient, because it is bacterial infection, that's why uh, it can be communicable disease. It is a communicable, it's not can be, it is a communicable disease. So it can spread in other people by its contact, so we have to isolate that person to prevent spreading to another person. Okay, maintain eyelid hygiene, because if it is in one eye, if we don't maintain the hygiene, it can be spread on the other eye also. Be careful removal of membrane. Okay, means when and the careful removal of membrane, but we cannot remove the membrane by ourselves, so we have to go to the doctor and doctor will remove it. Okay, and during the removal there may cause of bleeding, this may cause of bleeding. Okay, antibiotic and eye drop, because it is a bacterial conjunctivitis, so we have to give the antibiotic. And systemic antibiotic, diphtheria antitoxin. If the patient have diphtheria also, that's we have to give the antitoxin diphtheria, because if it is caused by diphtheria. Okay, and lubricating eye drop to moist the eye. Complication are corneal ulcer, scarring and vision. These are the complication can be caused by the true membranous conjunctivitis. Okay, next is pseudomembranous conjunctivitis. Pseudomembranous conjunctivitis is an inflammation of conjunctiva where a membrane is loosely attached and can be removed easily. Okay, it is nothing but inflammation of membrane which is loosely attached, sorry, which is loosely attached with the membrane. And if you learn the previous true membrane conjunctivitis, there is firmly attached with the conjunctiva. So this is the main difference between pseudomembrane and true membranous conjunctivitis. Okay, and in this removal, because it is easy, so there is no bleeding occur in pseudomembranous conjunctivitis, and we can see it without touching. There is just a there is a loosely layer attached there. Okay, causes bacterial infection, viral infection or allergy reaction, it may be anything. Okay, Then the next is clinical feature: redness of eye, watering and discharge, mild pain and irritation, swollen conjunctiva, thin membranous formation. Removal does not cause bleeding. Okay, and foreign body sensation. The clinical features are same, but this removal does not cause bleeding is different. And otherwise you can write also the clinical features of membranous conjunctivitis in pseudomembrane. Okay, then our sorry then the next is management and treatment. Okay, management is first lead hygiene maintain, because as it can be spread, so we have to maintain the lead hygiene. Then another is clean discharge regularly, because it is a bacterial infection, so it may cause discharge, so we have to clean it regularly. Antibiotic and antiviral drug. Okay, we have to give antibiotic and antiviral drug. Lubricant eye drop, inflammatory drug, and gentle membranes removal if needed. Gently, during removal we have to remove it gently. Okay, then next is complication is mild scarring, because we are removing it, so that's why it may be a scar there. Then dry eye and corneal involvement in severe case. If it is a severe case, then there may be a corneal involvement. Okay, now we will see the picture. Okay, this is a pseudomembranous. Okay, just think everything. This is loosely attached. Okay, we can see it from our naked eyes. Okay, and you can just see there is a membrane attached in the conjunctiva, and it's looking so different. Okay, here is redness. Okay, discharge also is coming. This is the main thing we have to learn about pseudomembranous conjunctivitis. And during its removal, we just remove it like this. Okay, just there is a cotton bud, and this, let's just think this is a cotton bud. Okay, we just swap it like this. Okay, then again we will just swap it, and during this there is no bleeding. Okay, now go to this true membranous conjunctivitis. Let's see the difference. There we can see the membranous conjunctivitis so loosely attached, but here it is firmly attached. Okay, I think this is a severe case, because during true membranous conjunctivitis it is hard to see the membranous conjunctivitis like this. Okay, here is also redness and discharge will come from here. There is also redness, and during its removal, when we remove this, there will be a bleeding. Of course it will be a bleeding. Okay, after that we have to put the antibiotic and the ointment. Okay, then during removal of 2 minutes conjunctivitis, we have to remove from the lower eyelid and upper eyelid both. So here also we will remove from this part also, both eyelid, upper and lower. Upper eyelid will be easy, but in lower eyelid we have to just split it, and then we have to remove it is like this. Okay, and if it is reoccurring, then we have to make a follow-up for removal, because if here is a membranous, if there is a membrane, the ointment we are giving to cure the conjunctivitis, it will not occur. Okay, it will not act on the spot, and it may be a long time to cure it, so we have to remove it, and we have to make the follow-up also. And as I am saying, it's a bacterial infection, it may be any other infection also, so don't be confused. But there is diphtheria, so I said that it is a bacterial infection. Okay, for today, thank you so much for listening me, and please like and subscribe. Thank you so much.